This is Dr. Stephen Hurd. I'd like to give you a description and explanation for the intravenous treatment that you're going to be experiencing. I use two types of fiber for the treatment itself. One is a laser fiber, the other is a radio frequency fiber. They both generate heat and ultimately result in the permanent closure of the vein, the target vein that's being treated. The day of the procedure, we'll ask you to come to the office approximately a half an hour before the treatment. We will be giving you a prescription for a Valium pill. We will instruct you on when it's the appropriate time to take the Valium pill. The treatment itself is not particularly painful. It's more the anxiety that we're concerned about taking care of with the Valium pill. As a result of taking the Valium pill, I would like to remind you that you'll need to have someone give you a ride home. We can't allow you to drive home after having taken a Valium pill on the same day. For the treatment, you'll go to the treatment room. The nursing assistants will prep your leg that's going to be treated, and then I'll examine your leg with the ultrasound machine and select a good location to cannulate the vein that's going to be treated. With the ultrasound machine, then I will select a location to enter the vein. I'll inject some lidocaine into the skin. With that injection, you'll feel a prick and then a slight burn for 2 or 3 seconds. I call it a bumblebee sting. Then through the numbed area of skin, I'll introduce the needle directly into the vein under ultrasound guidance. Then through that hollow needle, I'll pass a guide wire into the vein. The vein wall itself does not have sensation in it, so you do not feel the actual guide wire or catheter in the vein. I feed an IV over the guide wire into the vein, and through that IV I can introduce my treatment fiber. Again, the veins typically are relatively large, so it's unusual for you to feel the catheter fiber being advanced into the vein. But usually I'll be working about your knee or below, though the treatment will extend all the way up to the saphenofemoral junction in your groin area where the first valve is typically not functioning properly in the vein. When I'm satisfied that the catheter is in good position, then I inject a solution around the vein. The solution is called tumescent solution. It contains bicarbonate, it's normal saline, and it also has a small amount of lidocaine in it to numb the area that's being treated. What's required in order to introduce the tumescent solution around the vein is, again, under ultrasound guidance, I pass the small needle under the skin adjacent to the vein and inject the solution. The actual solution itself, typically you do not feel the injection, but rather just the needle prick in the skin. That does require a series of needle pricks along the course of the vein that's going to be treated, approximately 3 to 4 inches apart. So in total, on average, a person experiences between 6 and 12 needle pricks over the course of the vein. So in review, you will experience one bumblebee sting with a lidocaine injection, and then the series of needle pricks with the tumescent solution being injected around the vein. The tumescent solution serves 3 functions. One, it is has lidocaine in it, which numbs the area up so you don't feel the actual treatment itself. Number 2, it has a hydrostatic pressure that collapses the vein around the catheter fiber so that you have a good treatment. And third, the solution encircles the vein and acts as a heat sump, so that if there is any heat that's transmitted through the wall of the vein, it doesn't cause any damage to the surrounding structures. So now with the solution around the vein, the catheter in proper position, then I turn the treatment fiber on and seal the vein shut permanently. The actual procedure itself, at that point, typically only takes an additional 10 to 15 minutes to treat a vein. When the treatment is then completed, we put a little dressing on your leg and then the nursing assistants will help you put a thigh-high compression hoe on. And then we ask you to walk around the office or outside for 20 minutes if the weather is suitable. And subsequently, we have you check into the front desk and let the girls know that you're doing well, and then you're allowed to return to home. You can anticipate that you will develop some bruising and some tenderness along the course of the treated vein. Therefore, we do only treat one leg at a time. The bruising and the tenderness, though, are only surface tenderness in nature. They're above the level of the muscles, so it doesn't really restrict your activities at all. You can return to normal activities right away. I usually ask people to anticipate taking the day after the treatment off from work and having a light day, but beyond that, activity can be returned to normal. Certainly you can climb stairs, you can ride in a car, and you may shower after the first 24 hours. We do ask you to wear the thigh-high support hoe for the first 24 hours after the treatment, and then we ask you to wear the support hoe daily for 7 days. If you're going to have a procedure the subsequent week, we actually use the same support hoe. It has a waist belt, and we can just turn the support hoe inside out in order to use it on your other leg. Walking is very good for the circulation of the veins, so I do encourage walking. The only thing I do ask is that if you find yourself standing around, that it's better than to recline and have your legs elevated. I do ask that if you do a high-impact aerobics or heavy weightlifting, that you do avoid that for 3 to 5 days. But light jogging and regular exercise routine is allowed to return within 24 to 48 hours. There are not a lot of side effects to the treatment. The most common undesirable side effect that we tend to encounter is actually numbness of the skin, typically directly over the treatment site, and usually in the location just above or below the knee. The numbness is usually temporary. There is a nervous sensation, a feeling nerve, that joins the vein just above the knee, and despite the tumescent solution, which I described, being injected to protect the surrounding structures, this nerve is relatively sensitive to heat injury, though it also regenerates almost always within 1 to 6 months if you would experience any numbness at all. Other significant complications are very rare. Because you're awake for the treatment, you're not exposed to a general anesthetic, you have good muscle tone, we have you moving around immediately after the procedure, there's not a lot of soft tissue destruction from this treatment, and therefore it's uncommon to have significant complications. Blood clots in the deep veins, though extremely rare, is possible, though in my experience, we've been able to detect a deep vein blood clot in only a frequency of about 1 in 500 patients, and typically they're not serious even if they would occur. In summary, the procedure typically goes very well. As I mentioned, there's one bumblebee sting, a series of needle pricks, and that's really all the pain you should experience. And as I mentioned, therefore, the Valium is typically enough to, again, reduce the anxiety level, and there really isn't that much pain. Really, we want you to be able to walk in with a little apprehension, which is very normal, and hopefully walk out with a smile on your face, having realized it's really a smooth process to undergo the intravenous treatments. If you would have any other questions regarding the treatments, you can always ask the nursing assistants, and they know 99% of the questions, and certainly if you had a question that they were not able to answer, they'll ask me, and I'd be glad to give you that answer.